All right, so we are going to get started here right now. Just a couple of things. You're going to be on mute for most of the presentation. And if you are online and you can see the video, there's a chat box, and you can put any of your questions that you have for Blake in the chat box, and we will get to those. If you are not on video and you are on the phone, we will unmute everyone towards the end after we get through the chat box questions, and you'll be able, if you have any questions, to ask them. This presentation will be made available on YouTube after the fact, and we can send out, it'll be on Facebook, we can put it on our website, but we can also email it to everyone as well if you have any questions. So basically, towards the end of it, we'll unmute you. We're really excited about this. And I want to introduce Blake McCoy. Blake is the owner and president of Medicare Insurance Advisors. MIA is an insurance firm that is dedicated to helping people with their Medicare, life, and dental insurance. Blake decided at a young age of 19 that Medicare insurance was too confusing. It is. And he built a team of advisors with offices in Knoxville, Nashville, Memphis, and Daphne, Alabama, dedicated to make Medicare simple. They now serve clients in dozens of states throughout the country, so he knows his stuff for sure. Welcome, Blake.
Thank you. I am happy to be here on this beautiful fall day. Let me get my screen share set up here. Okay. Can everyone see my screen? We're looking good? All right, I want to do a test here. Okay. So what I will do is go through presentation first, and then we can go back through the chat box. I'd love to be able to answer questions, but also want to make sure that everybody gets a chance to ask any questions that they have in the chat box, and then after that we can open it up. So to get started with, I'm Blake McCoy with Medicare Insurance Advisors. I'm happy to be here. This is obviously a different type of event than years in past. So for those of you that have been to the Aging a Family Affair events, I have been privileged enough to get up in front of a few of you and walk around the room and use my hands. This year is a little different. I'm in my Knoxville office today. Normally I'm working from home, but I thought with a 9-year-old and a 6-year-old also doing their virtual school from home, maybe I should come to a place that's a little bit quieter. And that way you all don't see my kids flying through the background, or the dogs, or, our new normal world that we are all living in. So just want to say thank you to the Office on Aging for allowing me to be a part this year. I'm excited to be here. I think that it's wonderful that you all kept this going. I believe this is the 36th year. I think that's correct. So I just turned 38, so I'm only 2 years older than this event myself. But I got my insurance license 18 years ago as of September. So while I still like to refer to myself as being young, I have been in the Medicare space for quite some time, and it has definitely changed over the years. So with that being said, I'm happy to have each of you attending this morning. Hopefully you have some caffeine by your side, whether that be coffee or whatever you like. I don't want to put you to sleep, so I will try to make this fun and informative. And we'll go over some of the changes that are coming down the way in a couple of months. There are some pretty cool things that are being updated. So we'll just jump into that at this point. So first, I want to say that Medicare Insurance Advisors, we're not connected with or endorsed by the U.S. government. or the federal Medicare program. We are an independent local resource that can help with Medicare questions and enrollments and so on and so forth. So jumping into that, here we go. Let me organize my screen a little bit better. So these are some of the Social Security updates that I want to go over. In years past, I've actually brought in someone to discuss more in-depth Social Security, but I thought just for the sake of time and ease this year, I would go over a couple of the major updates that are starting to be released. So for 2021, there is a 1.3 cost of living adjustment that is, coming down the way. That is what the current numbers now. As I'm going through this presentation, I want to let you know some of the final amounts, deductibles, and premiums are not fully released just yet. They are estimated. So I want to let you know that there could be some minor tweaks over the next month. So there's a 1.3 COLA for 2021. Also, the Social Security full retirement age is going to 66 years and 10 months for those born in 1959. The maximum amount of earnings that will be subject to the Social Security tax will be increasing from 2020 to 2021, and made a note here. It is currently at $137,700 for 2020, and it will be going up to $142,800 in 2021. So for all retired workers, the estimated average monthly benefit is going to $1,543 in 2021, which is an average increase of about $20 a month. These are, obviously, there's going to be some more changes coming down the way. I'm sure a lot of people are watching TV right now and keeping updated with news, and I certainly won't go into that aspect of the world we are in, but I think that is something that is on a lot of people's mind right now, no matter what your age is. So there's 4 major bullet points for some 2021 Social Security updates. Now, let's see here. We will be jumping into my favorite thing, which is Medicare. And specifically, how do you sign up for Medicare? So you have a couple of options. Signing up and collecting Social Security. For those of you that are turning 65, happy birthday. And if you've already turned 65, happy belated birthday. So enrollment into Medicare is automatic, and you typically receive your card in the mail about 3 to 4 months before your 65th birthday. Right now, due to COVID, I have heard there are some delays there with receiving that card. So typically what we would advise is if you haven't received it within 3 months of your 65th birthday, it would always be a good opportunity to go ahead and call in and make sure that it is on the way so that you have everything ready to go. Next question is, let me make sure, I'm going to back up here 1 second. I want to make sure I didn't miss anything. So the next question is, when do you sign up for Medicare? Now, there are different enrollment periods, which can be based on age and can also be based on some health conditions. There are some health changes or health questions that I will be going over in a little bit as well. Some things that have never happened before, so I want to make sure that I address on those. Signing up for Medicare, you have an initial enrollment period, you have your general enrollment period, and then you also have a special enrollment period. And we will go through what some of these differences are on this next slide. So here's some important dates for Medicare enrollment. So Medicare is for 3 basic groups. And for those of you that are on Medicare, you may already know this, but I do want to go through this for those that are new. So your first basic group is people that are ages 65 and older. Your second group is for people under age 65 with certain disabilities. And then a third general group is for people of all ages with end-stage renal disease, or also ESRD. For today, we're kind of going to go through the basic of those that are 65 and older and or turning 65. So most people enroll into Medicare around their 65th birthday. You can enroll 3 months before your birth month, the birth month itself, and 3 months after, which gives you technically a 7-month initial enrollment period. Depending on when you enroll, coverage can start typically the month that you turn 65, with the exception if you turn 65 on the first day of the month, then your Medicare will actually start the month prior. So as an example, I'm an October baby. If your birthday was October 1st, then your Medicare benefits would actually begin September 1. If your birthday was October the 2nd, then your Medicare benefits would begin on October the 1st. So if you miss your initial enrollment period, you can sign up every year between January 1st and March 31st. And if you enroll in that window, then your coverage will begin effective July 1st. Under certain circumstances, you may be eligible for a special enrollment period. That would be something that's more specific that we wouldn't go into in this presentation. That's more of a one-on-one individual basis of certain special enrollment periods that are available throughout the year. Now, if you're still working and covered under employee group insurance, you can either enroll in Medicare and drop your group coverage, or you can delay your enrollment and stay with your employment program. The thing that you want to do there, and a lot of people are working later in age. So the critical thing there is when you're weighing out the option of whether you want to come off of your group plan or stay on that, you want to do a side-by-side comparison. You really want to take the time to do that on the front end, and you want to look at what your retirement benefit options are versus if you leave and go on the Medicare program. Couple of things, part of that decision would be, your copays, obviously premiums, out-of-pocket cost, whether you have drug benefits included, and also whether it's tied into any other aspects of your retirement plan. Before you leave your employer plan, you always, in my opinion, you want to discuss this with your benefits administrator. You also want to look, at your plan manager, and I would advise discussing with, a local insurance agent as well. That way you can do an apples to apples comparison and see what's going to be best for you individually. Because in most cases, when you do leave your employer plan, you're not eligible to go back to that. So it's very critical that you take the time to do that on the front end, because you don't want to leave your employer plan and realize that actually you had better benefits and you should have stayed with it. So it's always, something you want to do on the front end. That way you don't have to worry about not being able to go back to that employer coverage. Okay, so signing up for Medicare. If you're not collecting Social Security, 100 days before your 65th birthday is when you're going to want to enroll. You can do that in two different ways. You can call Social Security, which we have that number listed here. It's 800-772-1233. And you can schedule an appointment or go through different avenues to enroll that way. Another way that you can do, which is probably easier in most cases, especially now, is to go to Medicare.gov, and you can enroll that way. With COVID and just due to the time of year and access with certain things being open, some being closed. Just like in this scenario, sometimes it's easier just to go online and to do it at your own time and at your pace and convenience. That way you're not having to wait on hold. But either way, you can call in or you can just go to Medicare.gov and enroll. So let's go over original Medicare. And this is where I will try to spend a little bit more time being thorough, going over types of Medicare plans, the 4 parts, which are A, B, C, and D. We'll dive into those. And then, Part D is always the one that gets the most questions because it's a little bit more complex. So I have a chart on here that we will go through and some examples that will hopefully make it a little bit simpler. So original Medicare, it started, it was signed into law on July 30th, 1965. Just a fun fact, former President Harry Truman and his wife were the very first beneficiaries to have Medicare. And today, as of this year, there are over 61 million Americans that are enrolled into the Medicare program. And of course, as most of you hear, on average, it's 10,000 people a day that are still enrolling into the Medicare program. So this number is going up greatly every year. And that's most Americans, ages 65 and older, regardless of their income or health status. So as I mentioned a few minutes ago, there are 4 basic parts to Medicare, and we're going to start going into those now. A couple of notes on here that I do want to point out. We will see some 2020 numbers, and the 2021 I have included as estimates, but I do want to disclose that everything is not fully approved as of yesterday, but it does give you a guide to go off of, and I wanted to try to have more current information for everyone. So for Part A, for 99% of people, it is premium free. Of course, it's based on the number of quarters that you have been employed and contributed. The first 60 days are covered 100%. And Part A is referring to hospital care, okay? So that Part A, just remember, that is always linked to hospital. The first 20 days of skilled nursing is covered at 100%. And the deductible for 2020 for Part A in hospital was $1,408. Doing some research this week, it is estimated that it's going to be going up to $1,452 in 2021, but it is not finalized. So almost $50 as an increase, and that is the Part A deductible per occurrence. Keeping in mind with original Medicare, it covers at 80% on Part A and Part B, which is hospital and medical, but there is no out-of-pocket caps. That is something that a lot of people are not aware of. That original Medicare will cover 80%. You are responsible for the other 20%, and there are no out-of-pocket caps, which is why we'll go over some other options to help with that 20% coverage and or a Part C option. We'll go through those in here in just a couple of minutes. This is kind of wordy for those of you that that can't see it, but some of this I try to stick to just for compliance purposes, but also so you can see it. So again, Medicare Part A is for hospital care. It covers things like your hospital room, meals, general nursing, hospital services, and supplies. It does not cover private duty nursing, comfort, or convenience items. So coverage is for up to 90 days per benefit period, and the first 60 days are covered at 100%. after that Part A deductible is met. So you need to pay the deductible prior to. Then there is an out-of-pocket cost for any day after day 60, and it's broken down by day. And there is an additional 60 days of coverage called lifetime reserve days, but you can only use the lifetime reserve days one time. Also, it's important to note that the deductible, as I mentioned before, for 2020 is $1,408. And then that will be going up almost $50 in 2021 is what's estimated. So if you go into the hospital for a couple of days, as an example, you get discharged and then you return a week later, you are still in the same benefit period and you do not have to pay that deductible again. Now, if you go out of the hospital or the skilled nursing facility for 60 days or more and then return, then you would have to pay another Part A deductible. So the key there is how long you're admitted with Part A. If you're out for 60 days, then you would have to pay the Part A deductible again. If you're in for less than 60 days, then you would not have to pay the Part A deductible again. And just as a reminder, most people, 99%, do not pay a premium for Part A. Now, Part B is medical, okay? So once again, we have Part A, Part B, Part C, and Part D. Part B is for medical, and those are things that are outside of the hospital, which would include like doctor visits, lab work, x-rays, ambulance, emergency room, outpatient surgery, and also any prescriptions that would be administered in the physician's office. Right now, for 2020, the monthly Part B premium is $146.60. It can be higher based on your income. We will go through that in a little bit as well. So there is a difference. The more that your income is, then you can pay a higher Part B premium. That Part B premium is expected to go up a little bit for 2021, but it has not been finalized. And keeping in mind, Part B also has an annual deductible that must be met, and it is currently $198 is what the 2020 annual deductible is. Here's a little bit more of a breakdown for Part B. So Part B is optional. It is something that you do have to pay for, unless you will pay more if your income meets a certain threshold. But it can also be paid for if your income is under a certain threshold. Just as a reminder, it covers things like doctor's visits, lab work, x-rays, things that are outside of a hospital stay. And Medicare will pay for 80%, and then you will be responsible for the other 20% under original Medicare. So 2021, the premiums are estimated to, and once again, this is estimated to increase to $153.30 a month. That is not final, but that is an increase of almost $7 a month. And the deductible is currently at $198 for 2020. I'm sure that we will see that go up a little bit for 2021, and that is for the calendar year, not based on your enrollment, but actually the calendar year in itself. So you would only pay that one time in a calendar year for your Part B services. And if you are on Social Security, more than likely your premium is just being deducted out of your Social Security check before it's being deposited on a monthly basis. Now, here's a little bit more about the Part B premium. Realistically, I won't spend a ton of time on this one because it does vary based on income. But I wanted to show you a chart. So if you're looking at the bottom of this here, The individual income is based on 87, and this is for 2020, is $87,000 or less, which is where the 144.60 would come from. Now, as you can see, if you're following joint, or if you have higher income, the amount of your Part B premium increases. So as an example, if you take an individual that is under 87,000 or less, and these numbers will change for 2021, then you're paying the 144.60, but it is tiered. So there's income brackets per se, and the more that you pay, you can see that Part B premium continues to increase. The highest on this chart is for 500,000 and above. For individual income, that Part B premium goes up to $491.60 a month. Now, it's also at the top of this chart in a breakdown, there is a joint income as well. And for the lowest threshold, it's $174,000 annually or less. And then there are income brackets, once again, where that Part B premium increases every month, and it's based on your annual income, whether you file individual or joint. This is always a chart. If you have more detailed questions about how this applies to you, you can obviously call Medicare and ask questions about that specifically, or a local insurance agent can help explain that a little bit better as well in detail. So here's a couple of things. What you don't get with Part A and Part B. So Original Medicare does not cover things such as dental insurance, vision insurance, prescription drugs, which is also Part D, hearing, or help with long-term care. These are some of the things that Original Medicare does not cover. And keep in mind, Original Medicare pays 80%. You're responsible for 20%, and there are no out-of-pocket caps or maxes with Original Medicare. When you delay Part B, this is something that some people choose to do. A lot don't, but it typically comes up when you or your spouse are still working. So if you or your spouse are still working, you may be able to delay enrolling in Part B, but it is based on the size of the employer. Generally, it needs to be 20 employees or more is kind of the threshold there. And that is if you have coverage under an employer group health plan, or you are covered under your spouse's employer group health plan. Then if you have these coverages and fall into this, you will not lose your options and you won't have any penalties. So once again, this is part of, if you're on a retirement plan or a working plan through you or your spouse's employer, this would be part of what you would want to determine doing a comparison, whether you want to leave that employer coverage and go on Part B, or whether you want to delay that Part B based on what the plan options are for you personally. So now we get into, where do you go? This is really when it gets it can get more complex. The trademark that we adopted several years ago is Medicare is confusing, we make it simple. It can be confusing. We try to keep it as simple as possible, and try to just be a resource. And I recommend that, anytime you're weighing out your options, don't feel rushed. Just take a look at it, and you need to figure out what's going to be best for you. You don't want to just do what somebody else has done just because it worked for them. No one is a one-size-shoe-fits-all. So you always want to look at this in more detail for yourself. So you kind of have, this chart here shows three different paths. Do you stay on an employer group health plan? Do you go with a Medicare supplement, which is also called a Medigap plan? Or then do you look at a Medicare Advantage plan, which is called Part C? So this is a little bit of redundancy here on a retiree or a union plan, asking the appropriate questions. What are the copays and deductibles? Do you have a prescription drug plan? If you were to leave it, can you get back in at a later date? What's the cost? And does it include any additional benefits that you may need, such as dental or vision coverage? A Medicare supplement plan, those are standardized plans through all states. A couple of things that changed for 2020 that I do want to point out. No matter what plan letter that you choose, all insurance carriers are going to give you the same benefits. So a G plan with this carrier is going to give you the same benefits as a G plan with another carrier. The difference would be is what are you paying as the consumer, and those premiums can vary. Something that I want to point out here is why people look at Medicare supplement, and we have a screen on this as well, is it pairs with original Medicare. So oftentimes people that have original Medicare will purchase a Medicare supplement or a Medigap plan to pick up the difference of that 80% or the 20% that original Medicare does not cover. You still, of course, have to pay your Part B premium. Then you have your Medicare supplement premium. And then you would also, to have Part D coverage, you would have a third premium and pick up a Medicare prescription drug plan. A couple of things that changed as of January 1st of 2020, this year, is if you aged into Medicare January 1 of 2020 or later, you are no longer eligible to or able to purchase a Plan C or a Plan F. If you were prior or on Medicare prior to January 1 of 2020, you can still choose to enroll into a C or F plan. But if you aged in after January 1st, it's not available for you to enroll in. Most cases, what we are seeing is for those that are not eligible to go into a C or an F, they're selecting the Plan G. It's very popular, but also it does not cover the Part B deductible. So that's just something to be noted there. Here's a couple of bullet points as to when people typically choose a Medigap plan. When they want to budget medical costs, because you're paying a set monthly premium minus the annual increases that they take. If you travel a lot and you may need to see a doctor away from home. Also, if you want to be able to go to any doctor or specialist without having to look in a network or without having to have a referral. And then some of the plans help pay. Sorry, I'm getting a bit of echo here. Some of the, if you can, just as a reminder, please mute your phone or your computer just so we don't have any background noise. That would be great. Thank you. Some of the plans also help pay for the healthcare costs that Medicare doesn't. They fill in that gap of the 20%. And you can keep it as long as you pay your monthly premiums on time. Part C, which is known as Medicare Advantage. Their Part C, Medicare Advantage, and Medigap are not the same thing. A lot of people, no fault to their own, it's just not explained very well what the difference is. So Part C, what happens when you enroll into a Medicare Advantage plan, you do not lose Part A and Part B. Okay, you still have to have Part A and Part B in order to even be eligible for a Medicare Advantage plan. And you still have to pay for your Part B premium. However, when you enroll into a Medicare Advantage plan, it becomes your primary. So, even though you still have Medicare A and B, it is no longer your primary. So most plans are either a PPO or an HMO. Those are the most common. And what that means is that you have a network that you need to stick to in order to make sure that you have the coverage that you need. And if you were to go outside of that network, then you could either not have coverage, or you could be susceptible to paying a higher cost sharing for going out of the network. We live in an area where Medicare Advantage is very common and popular. My opinion is, being in this field for 18 years, it's really a personal decision. There is not one type of plan that is better than others. It really just depends on what you personally need and what type of coverage that you're looking for. There's usually a lot more than one or more plans in any county. Usually there's several. In certain states, I have seen up to 32 different Medicare Advantage plans in one county. So that can be pretty complex when you're trying to figure out, if you want to go the Part C route, which one do you even pick? They do include maximum out of pocket for medical costs, and they often include Part D included and some other benefits. Something to note that is very new starting for 2021, and I want to bring this up. So we are in the Medicare annual enrollment period, which started October the 15th and it goes through December the 7th. That's when a lot of people are, going through their Part D plans and checking their formularies and checking their doctor networks and co-pays and so on and so forth. You want to do that annually because these plans do change. So that's advantageous for you to do. But starting effective dates of January 1st, 2021, Medicare Advantage plans are now guarantee issue for all Medicare beneficiaries that have end-stage renal disease as part of the 21st Century Cures Act. Prior to, if you had end-stage renal disease, you were not eligible in most cases to enroll into a Medicare Advantage plan. That was the health question. That has now come off. So that is something definitely worth noting. It does affect a pretty large percentage of people that now have an opportunity to enroll into a Medicare Advantage Part C plan that prior to 2021 did not have that option. Here's some reasons, bullet points, why people choose the Medicare Advantage Part C route. Is because you often pay a lower premium. A lot of those premiums are a 0 monthly premium. You can use as a backup for VA. So for those that are veterans, you can go to VA and get your coverage there, or you can roll into a Part C plan and use that in places outside of the VA as a backup plan. It's for those that like having a network of doctors to go to. It can also be great for those that have a low income subsidy and get cost sharing on Part D copays and deductibles. Or if you just want to have everything all in one. If you don't want to have different premiums and different coverages, you can have one card and use that for everything. I'm trying to watch my time here because I want to make sure we have some questions or time for questions. Now, Part D, we could honestly have a whole nother seminar just on Part D itself. So I will try to keep this somewhat vague, but also helpful. Part D is for prescription drugs, and these are the prescriptions that you get from a pharmacy or mail order. These are not for prescriptions that are administered at a physician office. Prices and formularies are different based on the plan, and those do change every year, which is why this is the time of year you want to review the changes of the copays and the formularies. The formulary is basically the list of drugs that your Part D plan covers, and that can be very important. Sometimes it's included with retirement plans. There are late enrollment penalties that can be imposed if you do not select a Part D plan when you're eligible to. And veterans are not required to enroll, but they may choose to do so they could have a Part D coverage outside of VA. There is a thing some of you may be aware of. It's called extra help, also low income subsidy. For the income brackets, it is based on what your annual income is, and then also what your resources are. So for those of you that have income under $19,140 for singles and $29,160 for couples, in addition to resources less than $14,610 for singles and $29,160 for couples. I need to double check the resources. It looks like that may have been duplicated. But if your resources and your income are less than those numbers, you will want to apply for low income subsidy and extra help. What that does is it'll help you on your monthly copays for your prescription drugs, but it will also keep you from having to pay a prescription drug deductible, and you will be able to bypass the donut hole. So that's very important. If you are on the line or you think that you are under that, you'll want to apply. It's free to do so. We can help with that. The Office on Aging can help with that. There are a lot of resources to do that, and it's certainly worth the time because it can save you a lot of money annually. And this is what I mentioned. It helps with deductibles, copays, and premiums. For the income or the set copays for this in 2020, if you do get low income subsidy, your prescription cost will be no more than $3.60 for generic and $8.95 for brand names for 2020. In 2021, it's going up just a little bit, not much here, about 10 cents, 20 cents. Your copays will be set at no more than $3.70 for your generic prescriptions and no more than $9.20 for your brand name drugs. Now, this was the one I will watch here. So watch my time anyway. The 2021 Part D coverage gap, the donut hole. This is the chart, and then I have an example on the second one. So the 2021 RX deductible is $445. That can be paid, of course, depending on the plan that you have to cover your Part D. The coverage gap begins when you and your drug plan combined spend $4,130. And then it ends when you reach $6,550. That's when you go into catastrophic coverage. So keep in mind, it begins when you and the plan spend $4,130. Now, between the donut hole, the coverage gap, is the amount from $4,130 to $6,550. When you reach the donut hole or the coverage gap, you will pay 25% of your generic drugs. And then you will pay 25% of your brand name drugs, but 95% counts toward your true out of pocket, which is the $6,550. And I'm going to break this down just a little bit more. I know we have some questions here in the chat box, but I want to try to get through this. This will help. So for those of you that can see this, it should be a little helpful. So in 2021, Part D enrollees will receive a 75% discount on the cost of their brand name drugs during the donut hole. That 75 is broken down 70% from the drug manufacturer and a 5% discount from the Part D plan. That's where you get the 75 number. So with that 70% paid by the drug manufacturer and the 25% that you pay, that's the $95 credit based on those numbers that would count toward your true out-of-pocket exit point. As an example, if you reach the donut hole and you purchase a brand name drug that has a retail cost of $100, you're going to pay $25. That's what your copay is going to be. but you're going to get a $95 credit of getting out of the donut hole toward that spending limit. The maximum copay during the donut hole for generics is 25%. So the same math applies. If you bought a $100 retail cost generic drug, you're only going to pay $25, and that $25 count towards your true out-of-pocket exit point. This part can be very confusing. That's why I wanted to try to display it. And of course, if you have any questions, which a lot of people do, there's plenty of resources either with us or the Office on Aging that you can reach out to and get more clarification and help on this. There is a Part D senior savings model. I'll briefly go through this here because this begins January 1st of 2021. So, and it's based on participating pharmaceutical manufacturers. Basically what this does is Part D sponsors that are participating in this model, and it's not every Part D sponsor, they'll offer beneficiaries plan choices that give them more access to types of insulin. But what it's going to do for vial and pen dosage both, it is going, for those that are participating, it's going to set a maximum copay of $35 for a 30-day supply. This is a big deal for those that are diabetics because that can be very expensive. So with those that participate in the senior savings model, there will be a maximum set copay of $35 for a 30-day supply, and that includes both the vial and pen dosage. And that's in the deductible, the initial coverage, and the donut hole. So one of the estimates on here is that it will save an average of $446 in annual out-of-pocket cost of insulin. Once again, that's a number that was estimated, but it's certainly worth something you want to look into if you're a diabetic, having that flat set copay of $35 for a 30-day supply of your insulin. Okay, so I know I went through that kind of fast watching time. We can open up for chat box and questions. I'll also leave this screen on here too. Once again, just as a reminder, I have our phone number up here in our website as well. Our advisors are licensed and independent, and they do not promote one plan over another. So if we can help you in any way, we're here to do so and answer questions, but we do not promote one carrier over any others or any type of coverage over any others. All right, let's see here. Let me try to get to the chat box so we can answer some questions. One of the okay, yeah, so we have some notes on here too. So obligations does someone have if they're already on a Medicare plan due to a previous disability and turning 65? Well, a couple of things. Depending on the type of plan that you have, you can stay on the current plan that you have. But if you're returning 65, that puts you into an enrollment period that allows you to research and possibly make plan changes if you do need to enroll into a different plan. So I wouldn't say that you have any obligations to a certain plan, but by turning 65, it gives you an enrollment period that you can research enrolling or making a new plan change. And yes, dialysis. So once again, this is going to determine the type of plan that you're on. So if you have original Medicare and a Medigap plan, that can be a different answer from someone that has a Medicare Advantage plan. If you have a Medicare Advantage plan, keep in mind there are networks that you need to stay into to make sure that you have the right coverage and are not paying any out-of-pocket cost. So here's a good one. So we talked about the senior savings model. There is a list that is published on CMS's website that is being updated. So you can check in specifically if you're looking at a specific plan. That's one route to go and find out if they're in the senior savings model. Another option is that information is being posted on CMS's website that allows public information for people to know who is participating. The list has been growing. So since this came about, it was a smaller list, but more and more Part D sponsors are coming into this. Another question we have: if someone was misinformed about signing up and have to pay a penalty once they do they pay the penalty for the rest of their life, and why? That is a really good question. So I don't want to assume here, with that penalty, is that whether that be a Part D penalty or whether that be an original Medicare penalty. I'm going to go with Part D. If they were misinformed about signing up on a Part D plan, that penalty, unfortunately, okay, the Part D penalty, yeah, the penalties don't go away. That is the unfortunate part. So once again, this is where it's really crucial to do the due diligence on the front end and comparing the plans and comparing when you are going to enroll. You can appeal it. It would have to be appealed through Medicare because that's where the penalty comes from. And also to point out, if you do enroll into, let's say, a Medicare Part C or a Medicare Part D plan, they will notify you if you are required to pay a penalty. And that penalty is tacked on to what your monthly premium is and never goes away. The longer you wait, the worse the penalty is. So yes, you can appeal. I've seen it happen before. I've seen some denied. I've seen it go both ways. But it is crucial when you're coming off of a group plan or a spouse's benefit plan to make sure that you choose the right enrollment period. That way you don't have to worry about these penalties that you have to deal with forever. Yeah, the appeal is not used often. Truthfully, I haven't seen it happen a lot. There can be exceptions. If you had credible coverage, that would be another thing that you would want to ask about. Is there are credible coverage options that can keep you from having the penalty. And let's see here. If you're if you're already on Medicare, but is it cheaper to go on your spouse's plan? Can you come off Medicare? Typically, once you have Part A, you would keep that. Most people do not go on Medicare Part B and then come off of it. They would typically keep that in most cases. Personally, I haven't seen that happen. Not saying it hasn't. I just haven't seen that in my experience. Yes, that's a very good point. That if you qualify for assistance, the penalty is not applied. That is something, once again, it never hurts to apply for assistance. It doesn't cost anything. So, we recommend that anytime you're even close to the income thresholds, go ahead and apply. It doesn't hurt anything. It doesn't cost anything. But it can be very helpful because think about it. If you qualify for the assistance, not only could you waive the penalties, but you're going to have set copays on your Part D prescription drugs, which are substantially lower. You're also going to bypass having the donut hole. You're going to bypass having the initial deductible. it's just a really good thing that if you qualify, absolutely apply. And incomes can change, so you can keep applying. It doesn't cost anything. If someone wasn't informed correctly, we should advocate, right? Yeah, I mean, absolutely. I think right now, and this is a little bit off subject, but it just makes me think of this, like in our current pandemic, the current situation, right? I say this to my wife and kids all the time. Anytime that people can help each other as a community, whether it's us, whether it's the Office on Aging, because there are amazing people and resources there. Right now is one of those times that we all need to come together and help each other. Whether it's a simple question, whether it's advocating for someone to get a penalty removed, whether it's for low-income assistance. Now, of any time that I've seen in my career, now is the time when we all need to come together as a community and help each other. There are, unfortunately, some people in our community that are having to make decisions right now of whether they are picking up their prescription drugs or keeping their lights on, or whether they're able to go get their prescription drugs, or whether they're going to the store to pick up food. Now is really critical for so many people. And I think, we all need to team up together and do whatever we can to help one another. Let's see here. Another question. Work hopefully until age 70. If my wife files for Social Security at age 65 to help pay for Part B, she will not get full retirement, only a percentage. If later she switches to my Social Security, will she get 50% or only get a percentage based on early filing? That's a great question. Just to be completely honest with you, I would ask one of the Social Security experts that we work with on that question, because we don't do any Social Security planning, and I'm not a certified Social Security planner. So I don't want to get into a lane that I can't give you the correct answer on. But to your point of the first part of it, yes, the longer that you can delay retiring, the more benefit and your higher monthly income will be. So most people are starting to delay that to later ages, if at all possible. But I don't know 100% whether that would be 50% on her filing. So I would want to connect you with a Social Security expert on that question.
Did you see the ambulance services? Did I miss that one?
I think let me scroll here. Ambulance services, yes. Thank you. Are they covered by Medicare Advantage plans? And yes, ambulance are covered, and they have a set copay based on the plan. That is part of the benefits that you want to look through. Those can be a difference based on ambulance copay. Emergency room with Medicare Advantage is also covered. And even though Medicare Advantage Part C plans have networks, your emergency room coverage does not have any network. So if you are traveling, let's say you live in Knoxville and you travel to Asheville or Florida or out west, you would always have emergency coverage, and it is a set copay with all the plans. So you wouldn't have to worry about any networks there. Same thing with ambulance. You don't have to worry about a network covering that. And thank you, Angela, for bringing that out so I didn't miss that one.
And so someone just messaged me and asked, they maybe missed this, but what are the maximum out-of-pocket costs under an Advantage plan?
So every single one of them is different. And it's a really good question. So original Medicare, there isn't one. But there is definitely just to be frank about it, there is a large range of maximum out-of-pockets with Medicare Advantage plans, especially in our community. There can be a difference of thousands of dollars annually. So, when you're looking at Part C plans, there's a breakdown, right? And this is what a doctor copay is. This is what a specialist copay is, emergency, so on and so forth. It's all laid out, but you do want to look at the maximum out-of-pocket cost. The maximum out-of-pocket cost on Plan C, Advantage plans, that's on your medical and hospital. That has nothing to do with your Part D. That's separate, even if it's included in the plan. So there can be a range of, maybe a $3,000 out of pocket to some as high as $7,000. That's something you really want to look at when you're making comparisons between those plans.
Awesome. Thank you. It doesn't look like there are any more questions in the chat, and this may be a little messy, but we're going to unmute everyone. So if you have any background noise, we ask that you turn it down, please. But if you have a question, we'll take a couple more, and if not, we're going to thank Blake for coming and presenting all this wonderful information to us. So we are unmuting.
Fingers crossed.
Yeah. Oh, no. Unmute all. Maybe not.
There is one question I'll read off that just came in. If you have extra help with your Medicare Advantage plan, would that cover the ambulance copay and deductible? So the term extra help, low income subsidy, applies to the Part D benefit only. It does not apply to your medical or hospital coverage. So that would not have anything to do with the ambulance copay, only the Part D benefit.
Okay.
Hopefully I didn't put everyone to sleep. I have my water and caffeine here, so we'll see.
Thank you, Blake.
Oh, thank you. I'm happy to be here. I really do thank the Office on Aging for putting this together for all of us, because I think right now it's really cool to be able to come together and still be able to move on in a different world. I'm happy to do my part in any way I can, and appreciate everybody for attending. Hopefully, I didn't put anyone to sleep. My wife and kids fall asleep every time I start talking about it, so I don't know.
Thank you, Blake.
Hello, I have a question. For the people that are on the phone, could we get Blake's number?
Yes, his number is 865-691-5571.
Thanks.
Any more questions?
Yes, I have a question.
Yes, ma'am.
If you retire early, is there any way that if you go back to work that would help build up your Social Security?
I mean, your Social Security benefit, so typically, once I would say that could be, I would want to have you talk with a Social Security expert on that one to see what that would change. Because if you've already taken that early benefit and then go back to work, there would be a calculation for that. But that is something where I would default to one of our Social Security experts that would be able to help with that, honestly. That way you could really see what that would look like.
Thank you.
Any other questions? Okay.
There is one more question.
Okay.
Go ahead.
Is the out of pocket or the max out of pocket on Part C, is that a yearly max out of pocket or a lifetime out of pocket?
So first of all, I have to say I love your background, because it's not every day I get to see a palm tree. So I love that, by the way. So the max out of pocket on Part C, that is for every calendar year. January 1 through December 31st with every plan, and it starts right back over January 1 again.
Thank you.
You're welcome.
I have another question. If you have a Medicare Advantage plan at this point, and you want, and this is the time you can change, can you look for one that has changed to one that has a lower out-of-pocket?
Yes, you can. And now is actually a time when a lot of people are doing that because we're in the Medicare annual enrollment period. So how that would work is whatever the plan that you have now, you can compare that with other options, and then you can make that plan change, and it will go into effect for you on January the 1st. Any enrollments that are done during the annual enrollment period, using that as the election period, which is from October 15th through December the 7th, all of those plan changes will take effect January 1 of 2021.
Okay,
So
thank
for
you.
Part D also. That's for Part D and Part C. The enrollment window is the same. And one thing I will add, just because it reminded me of that, so throughout the year, there are enrollment periods that apply. They're called special, enrollment periods, and they can be based on if you're moving, like if someone were to move into a facility, if someone were to move to a new county, if you qualify for low income subsidy and or Medicaid, there's a list of probably 30 or 40 of them that are SEP or special election periods that you can choose throughout the calendar year. So we will have another one starting in January that will be another enrollment period after this one. So there are some options throughout the year based on some of those SEP periods.
If you're working and quit working, that also is a special enrollment period, is it not?
That is correct. Just make sure if you are on an employer plan before you do so, make sure, and if you have coverage, make sure that you compare apples to apples so you know exactly what you're leaving, what you're going to have, and then that way you're making the right decision. Because most times, once you make that change, you can't go back to that previous employer plan.
Okay. Last call for questions. Okay. Well, thank you so much for coming to our first virtual Aging and Family Affair presentation, and thank you, Blake, for presenting. There's very, very information-packed information and quality information. Really, this was wonderful. If you have any questions, remember Blake's his office phone number is 865-691-5571. Or you can look in your senior service directory and look up Medicare Insurance Advisors. They have an ad in the back. It's very nice. You can see all the information on there as well. Again, thank you all so much. We'll see you next week, November 13th, for Planning for the Future with Glenn Kyle from Franklin and Kyle Elder Law. And that will be the same login information. So we will see you all next Friday at 10. Thank you.
Thank you, everyone. Have a great day.
Thank you. Thank you.
Thank you.
Thank you.
Thank you very much.
Thank you.